Hi, I'm Dr. Julie Steinauer. Let's talk about a condition called convergence insufficiency. Now, what that means is the person who has this problem has difficulty crossing or aligning their eyes to a specific target. Before we jump into more details about convergence insufficiency, let me tell you about how you can connect with us. If you're local to us, give us a call at 618-288-1489. If you're not local, you can still connect with us about how we might be able to help you. You can go to our website at visionforlifeworks.com and do one of two things. Either fill out a questionnaire, or you can click on the schedule a consultation button and schedule a consult direct with me. Now, let's go back. Let's talk about convergence insufficiency, where the person has difficulty crossing and aligning their eyes to a specific target. What that means is when we look at something far away, our eyes are typically going to be and should be lined up straight. But as soon as we go to cross our eyes and look at something close to us, okay, our eyes need to cross in, and that's what's called convergence. And if our eyes have difficulty crossing in, it's called convergence insufficiency. It may mean that we have difficulty going from one distance, like distance far away, to up close and converging, or it could be that we have difficulty maintaining convergence and alignment of the eyes in, like if we're reading a book or doing homework or studying something for a longer period of time. So there's multiple different types of how the convergence problem can kind of break down and be an issue. Now, what do we do about it? So there are two things that we do that kind of fall under the heading of vision therapy. The first thing that we use are syntonic filters, which we've talked about syntonics filters an awful lot. You know I'm a big fan of the syntonics filters. And what happens is when a person is wearing them and they're looking at a light using the filter that's specific towards helping them if they have a convergence problem, what happens is the brain is electrically triggering the muscles around the eyes specific to converging to actually help the brain learn how to converge and align the two eyes together. So it's basically kind of telling the muscles what to do a little bit better. The second part of our treatment is really more mechanical or motor in nature, where we teach people how to have, proper and good tracking and accommodation or focusing skills with each eye separate. And then when we go to teach the brain to converge and align the two eyes together, we have a more equal or symmetrical system that the brain is able to learn how to converge better. So it's kind of electrical and motor or physical in terms of how we treat convergence insufficiency. Now, people can have this at any age. In adults, it may look like someone falling asleep and getting tired after reading for a short amount of time. Maybe it looks like they're having difficulty staying focused or, staying on task. For kids, it definitely could end up looking like something like an ADHD, where they can't stay focused or don't want to sit still even, particularly when it has to do with reading or schoolwork. Now, if they have a real true focusing problem, it will affect them everywhere. It doesn't matter what they do. Even if they sit down to play Legos or put a puzzle together, or if they're watching a movie, they will have difficulty sitting still if they have a true case of something like ADHD. If it's not really a true case of ADHD and it's just this convergence problem or this convergence insufficiency, then what that means is you'll probably only see the focusing issue and the problem sitting still associated with near work, like reading, writing, homework. Okay, so schoolwork in general. So that's one way that you can tell the difference. And a lot of times they will be energetic kind of kids. So that's a couple of the ways that you might be able to recognize convergence insufficiency, either in an adult or a child. People will also tend to lose their place and could potentially, like when they're reading, could possibly also have problems with remembering or retaining what they've read, and so it could affect comprehension. But they also might say or suggest that they see double, and that's another big thing to be looking for as a symptom of convergence insufficiency. Now, the tricky part about that, a lot of times kids don't know what double really means. They might just say it looks kind of blurry or weird or smeary, where things kind of run off the page. But if you ask them more specifically, you know, when you're looking at something, does it even kind of go like this, jiggle or move or wiggle around? They might a little bit better be able to tell you yes or no. They still may not understand that the blurriness that they see and is really kind of more like a double vision. So you can't always, you know, bank everything based on that response to that question. So convergence insufficiency. It can look like a lot of things, including having difficulty sitting still and focusing, like an ADHD. We kind of talked about how we correct it in our office. So if you have questions and you'd like to talk with us, you can call us if you're local at 618-288-1489. If you're not local, you can still connect. Go to our website at visionforlifeworks.com and either fill out the questionnaire or click on that schedule a consultation button. Now, if you like this video, we would love it if you pass it on and hit the like button. And if you haven't done so already, please subscribe to our YouTube channel so that you get notifications of all of our videos. Thank you.